Welcome to Altea Talks, the brand new podcast series being brought to you by Altea, the unique provider of combined insurance and risk management solutions designed exclusively for the medical, allied health and care sectors. I'm going to be your host, Will Marshall, and I'll be joined in this series by some of the leading movers and shakers from across the sectors. My guests are going to include practitioners and professionals, regulators, clinical risk and governance specialists, and an array of legal experts who are going to help us get to the heart of the hottest topics affecting health and social care sectors today. So, if you're looking for frontline knowledge and expertise, if you want valued insights into these most dynamic, challenging and rewarding of sectors, then look no further because you're in the right place. Welcome again to Altea Talks. Hello and welcome to this next episode of Altea Talks. In this episode, I'm delighted to be joined by Simon Gilchrist. Simon is an Australian qualified physiotherapist who graduated from La Trobe University in Melbourne in 1998. He completed his Masters of Sports Physiotherapy in Australia in 2005 and has achieved the sought-after title of APA Sports Physiotherapist. He's also recently completed a graduate certificate in Diagnostic Ultrasound, which he uses to scan soft tissue pathology to help achieve diagnosis. Simon has over 18 years' experience as a very successful established physiotherapy practitioner. Since coming to the UK, he's helped to establish a successful clinic in Marylebone in central London before co-creating Mayfair Health, where he's currently based. Mayfair Health is a leading group of multidisciplinary clinics providing physiotherapy, movement, Pilates, personal training, nutrition and health and wellness services, amongst others, from locations in Mayfair, Marylebone and South Kensington. Simon describes his approach to physio as very proactive, and he uses a combination of manual techniques, neural mobilization and manipulation, often in conjunction with acupuncture and dry needling. His special interests are in knee and spinal rehabilitation and tendon pathology, with a real emphasis, as we're going to hear, on preventative medicine. Simon has a passion for all sports and fitness. He used to compete to a high level as a 400-metre runner and has a special interest in track and field, as well as cycling and football. He's travelled and worked extensively with Australian Olympic athletes, so is undoubtedly delighted by the Aussies' sterling performance at the Paris Olympics this year. Away from the treatment room, Simon guest lectures at the Royal College of Surgeons. Simon, welcome to Altea Talks.
Well, thank you. Very kind of you to ask me to be along here.
It's a pleasure. And I think really to kick us off, and for people who don't know you, would you like to tell us a little bit about yourself?
I think you've said a lot of it, actually, but makes me feel incredibly old hearing all of that sort of stuff. I think I've actually been in the game for about 25 years. I probably need to update some of my bio. But yes, I'm Australian, born and bred, lived in Melbourne and grew up down there. Always had a huge passion for sport and running around. I think my mum described me as a very active child and always had huge bundles of energy. So played a lot of high-level sport, Aussie rules football, but was a good track athlete. And then travelled, sought out sort of physio as a chosen career, and travelled for a period of time and ended up over here in 2000. And since that time, have married, children here on the other side of things personally, but have sort of grown and developed clinics and built a nice team to offer sort of a high quality healthcare and wellness to clients and individuals.
Yeah, thank you. And obviously with such a sporty background, you were presumably drawn towards a career in physio, but is there an early memory of an aha moment or a particular thing that attracted you to physiotherapy, and when you realised that this was your calling?
Yeah, through running, I spent a little bit of time at the physios. So I was, 14, 15, 16 and tearing the occasional hamstring or having a little bit of what we call patellofemoral joint pain, and had worked closely with a couple of very, very good elite physios and sort of thinking, you know what, this is a pretty cool job. You know, I get to mix that sports and active sort of passion and helping people and being the one to actually make a change to people in terms of being passionate about that clinical side of things, but also had a real interest in sort of the human body and biology as well. So I think it was then that I was sort of pushed towards either medicine or physio, and then perhaps my lazy genes took over and I was like, physio is an easier pathway, so I'll head down that pathway.
Right, thanks. And you completed your Masters of Sports Physiotherapy qualification in 2005 and earned the title of APA Sports Physiotherapist. What are the key skills and knowledge that you gained from these advanced qualifications that have been most helpful and impactful to you in your practice?
I think I was lucky enough to go through La Trobe University, and at that point in time, there were some world-leading gurus in their field in terms of pain medicine, sort of tendon pathology, and some of these names are still considered sort of the leading gurus in their area. And it's just broadened that depth of knowledge. So there was a vast base of evidence that we sort of had to pile into for a lot of these areas. And you just accumulate that breadth of sort of knowledge in tackling some of these subjects, but also meeting other like-minded individuals who are on similar pathways around the world. And so there's a big sort of sharing of knowledge. I think that was one of the key things that I gained from that, but also thinking about the bigger picture, it exposed you to that elite environment and what people were doing across multiple sports and how they were managing different clinical situations. And I think it just gave you a level of confidence and really helped to improve your clinical decision-making, because you were then being exposed and surrounded by lots more case studies, lots more evidence that you could go back and use that knowledge appropriately to further challenge and identify what was going on with your particular patients.
Yeah, thanks. And I guess your background as an athlete yourself, as a 400-meter runner, your experience in cycling, I think you've completed a stage of the Tour de France.
Yep.
That must give you a unique perspective as a sports physiotherapist. And I suppose my question is, how has that personal experience of competing at a high level in sport influenced your approach to treating sports-related injuries?
Yeah, good question. I think if you don't understand or you haven't competed at a relatively high level, or you haven't engaged in sport and worked around sort of professional levels or even elite amateur levels, then sometimes challenging to understand their mindset. So it's very difficult to appreciate what it's like to be injured, the intensity of which they need to train, the devotion and dedication that they need to commit to, their sport or their pastime that they're trying to achieve, and then how you manage that psychology based around someone's injury and the not just the physical effects, but the emotional effects of them being injured and out of the game or out of not being able to play sport. And what does that mean? Does that mean that their salary might be cut? Does that mean that they're, suddenly on the chopping board from being cut from the team? Does it mean that, okay, their dream of achieving their Commonwealth Games or Olympic Games selection is also in the balance? So I think performing at a high level just gives you much greater insight to their mindset, how they need to train. And then it also gives you a very good and clear understanding about how incredibly hard it is to achieve that top sort of 15, 20%. The last 5% in most sports are probably all up between the ears. But the last 15% in terms of performance, these athletes need to work so incredibly hard. And unless you've pushed yourself to that level, then you perhaps don't identify that. You don't see that. So I think it's massively helpful for someone who isn't working at the top of the game to have actually been in the game and worked hard and enjoyed their sport at a very good level.
Yeah, thank you. That's a really great answer. I mean, I guess just talking to you now, I suppose I hadn't really appreciated the importance of the psychological element. It's such an all or nothing existence, isn't it?
Yeah.
If you look at, I don't know, someone like Ben Stokes, just done it or has injured his hamstring in the summer, was out for the whole of the rest of the test season in the UK. And in a split second, your world changes pretty drastically, doesn't it?
Yeah, look, it's really, for Ben Stokes, I'm a massive cricket fan. I think it's, awful news for England cricket fans, but it gives other people opportunity. But actually for him, who's been struggling with his knee, not being able to bowl and perform as you would like, and then he's been back and looking good from a bowling point of view, and suddenly he's hit with his hamstring injury, which is putting him out for a decent chunk of time. So the mindset and sports psychology now plays a much bigger role in, and he will have done a lot of work on sort of mindset, and he's come back from a lot of different injuries, so he understands. He will understand that sort of process very well. But I think there definitely needs to be discussions had with these individuals, and psychologists brought in to that team to ensure that actually they are managing their head and headspace in the right way to help to improve that injury process and that injury pathway.
Yeah, thank you. It's clearly the whole treatment is sort of looking at the overall holistic picture, and I think we'll come on to that in a little bit. But can I just ask you a couple of questions about your physiotherapy practice? You advocate combining manual techniques, neural mobilization, manipulation, and on occasion, the use of acupuncture in your treatments. How do you decide which combination of treatments to use for a particular patient? And can you share an example where this integrative approach has had a really successful outcome?
Yeah, sure. I think one area that is perhaps lacking in there is the exercise-based approach as well. And I think in medicine or the physio world, manual therapy is sometimes almost considered a slightly dirty word, because there's not a huge body of evidence that manual therapy makes significant long-term changes to people. However, we know that actually putting your hands on someone is an amazingly powerful thing. There's a direct healing effect. And so we can see that, we might mobilize someone's cervical facet joints or release their tissue, and immediately they get up and go, oh, wow, my range of motion is improved. So there's a direct correlation to what you're doing. Now, that doesn't necessarily last for a prolonged period of time, and exercise is usually the medium that makes the long-term significant gains, but using your hands, it can be extremely powerful. So using a combination of techniques in terms of soft tissue, and there's lots of different approaches within that, mobilization, neural mobilization, often dry needling or acupuncture, can be incredibly effective. I think how do you decide which approach to use is dependent on the pathology and what's in front of you. If it was a spinal injury, then often it would be a combination of some manual therapy and mobilization, and maybe some acupuncture to release off that tissue. But I'll often be led by the client, because you mention acupuncture to some people and they run a mile. So if the client doesn't buy into any of that approach, then immediately I'm like, well, actually, I'm probably not barking up the wrong tree here for that. But most of the time I will do something that's called a treatment direction test. So we have a slightly scientific approach in that we might assess someone's range of movement or how they move in terms of control parameters. And then we will do a technique, whether that be tissue work or mobilization, or whether it might be some simple activation exercises, and retest that, what we call asterisk sign. And what we want to see is that there's been a change and there's improvement. And that will then help to determine our next path of treatment. And that is, a nice scientific approach to actually understanding what's going to be effective for that individual.
And you've relatively recently, or perhaps not, but you certainly have added a graduate certificate in diagnostic ultrasound to your qualifications. How has incorporating ultrasound into your practice changed the way you approach soft tissue injuries? And can you talk a little bit about the advantages that it offers in achieving accurate diagnoses?
Yeah, sure. I think it's been a massive game changer for me. I think more physios and therapists should be using this because it's such an easy point of care device, despite the cost involved. But it offers massive layers of extra information that you cannot get purely just from a clinical assessment. We will have a diagnosis based on your clinical assessment, but actually you're still then waiting for an interpretation of the underlying structure. So the diagnostic ultrasound has been incredible at allowing me to gain more of a depth of understanding about the spectrum of pathology that we might be seeing at that local tissue, so that we can understand that, that is quite a reactive inflammatory tendon, or it's actually more of a degenerative tendon, and there's vascularity within that area, which might lead us down a slightly different treatment pathway. So it allows us to be more specific with our diagnosis. Then that might mean a more specific referral into a sports doctor who might do PRP, for example, or we might need to then get into a surgeon because we picked up something that we didn't expect. And that has really added a lot of value to our clients and patients. And it's a lot of training to do that, but I think it's a massive area that physios in particular, who have such good understanding of the rehab process, could really benefit from taking on board.
Yeah, it sounds like a very effective tool used in conjunction with the other sort of more traditional MSK.
Yeah, completely.
Technique.
It's a great way to add layers to your diagnosis.
Sure. Now, you're particularly passionate, aren't you, about preventative health?
Correct.
And the concept of prevention rather than cure is very much in vogue at the moment across the whole health sector.
Yep.
Why are preventative strategies such a key component, in your view, of modern physiotherapy services?
I don't think they should just be key to modern physio services. I think actually we need to think about a preventative approach across all healthcare. And if we look at, the NHS, for example, and, different people will argue that, that may be broken at the moment. For the first time, a Labor minister has come out and said as much. Now, that probably should be known as the National Disease Centre or the National Disease Service. And there should be a separate approach and pot of money looking at optimizing people's health so that they're not getting into that situation down the line. Now, I very much look at sort of longevity and optimizing people's health span. And if we're all probably going to pass away from 4 key conditions: neurodegenerative conditions, cancer, metabolic diseases, and cardiovascular. Thank you. And there's so many things that you can do to prevent the occurrence of those. And the biggest lever that you can pull, if you eat okay, if you sleep okay, if you manage your stress okay, the biggest lever that you can pull is exercise to make substantial change to reduce your risk across all those parameters for cardiovascular risk, cancer, neurodegenerative diseases, and your metabolic diseases. And these are the things that cost billions and billions for this country and around the world. And I think where our team and my practice has evolved a little bit more is that we are looking at someone comes in for an ankle injury, but we're like, why did that happen? Well, that's because you're unstable around the pelvis. And actually, that's because you're only doing 1 exercise session a week. If you're thinking about optimizing yourself to reduce any of the risks for any further illnesses, this is what you need to be doing moving forwards.
Yeah, and I think that we, as I said in asking the question, we are seeing a rather belated, but nevertheless a response from the authorities that message is clearly now gaining significant traction. I think particularly in the context globally of an aging population and a recognition that the key metric is not so much life expectation as healthy life expectation.
Correct. And I think, are we going to live to 110, 120? Well, who knows? Maybe. Not everyone wants to. But I think the goal should be that we want a very good health span so that the last 20 years of your life, you can still travel. You can still pick up those cases and put them in an overhead locker. You can still walk and run up those stairs. You can still go hiking with your grandchildren, pick up your grandchildren and not succumb to, mechanical injuries, osteoporosis. The rates at which that occur are incredible. Or any of these other conditions, you massively reduce your risk by exercising well, by stressing your cardiovascular system, by keeping strong and having that strong skeleton. And I think if you can do that, then you can maintain a good health span in your last 2 decades.
Yeah. And you touched on the way that your practice tries to encourage and help people to achieve that. And I know that Mayfair Health offers a wide range of treatments and services across its clinics, including an emphasis on specialist health and wellness services. How important is it to integrate services such as nutritional advice and lifestyle assessment with other more traditional MSK treatments?
I think it's vital, partly from a business point of view, because I think you'll get left behind if you are not progressing in those other fields, because you've got a whole plethora of different individuals who might have trained as sleep experts or life coaches or PTs, and they're dipping their toes into all of these areas. And I think we have a really, really, as physios, we have a very, very solid clinical background and clinical training, and we are very well positioned to be the champions of wellness and exercise because of our training. And I think if we are not doing that, you'll be left behind. Now, I think in terms of offering and trying to tackle some of society's problems, I think we're well positioned to do that. And running a business, I think that we need to over-deliver to our clients and offer them way more than what they get at Joe Blogg's around the corner and their physio service. Because one, we want to help people and we want to optimize that individual, but two, we also want them to buy into the rest of our ecosystem. So we discuss nutrition, we discuss, running their hormone bloods, we discuss all of this. We use different services within that, and some people don't want to engage with that, but a lot of people do. And so, I will discuss protein intake and optimizing their diet, but actually my level of knowledge is pretty basic compared to a nutritionist. So we have that referral pathway on board if we need it, like we have psychology, like we have pain specialists, like we have a multitude of different experts in their field, because we want to give people the best advice at the right time.
Yeah, thanks. And just to stay with the business, if we can, and with Mayfair Health, what have been some of the biggest challenges and rewards that you've faced in building and growing such a successful practice over the years?
Well, it depends how you determine success. That's an interesting one. But the challenges are many. Certainly in the early phase, I think cash flow was a massive issue for a small business starting out. It started with me, and you need physical sites. Suddenly you're putting up 6 months rent as a deposit, which is just lost money into the ether. So cash flow can be an issue. And when we talk about working with insurance companies, which I'm sure we'll perhaps delve into a little bit later, the health insurance companies that we work with, they're slow payers. Yeah, so that becomes an issue of its own. So cash flow has been one of the biggest people. I think recruiting the right people. I think, we're in a profession, which is hard to scale. It's not easy to scale because it's a labor-intensive profession, and recruiting and maintaining key individuals can be challenging. We can't pay the sort of salaries that are on offer in the law profession, in finance, because we don't get paid that much. And that's another area to dive into. But the other challenges, I think, as we've grown, trying to manage the HR side of things, having 20 odd people sort of involved in the business now, it's starting to become a slightly bigger beast. And there's always illnesses and sicknesses, and someone's not happy, or there's niggles between staff members, and those take a lot of time. And actually, they're probably an area where you feel under-resourced and under-supported as a business owner. And they're probably some of the biggest sort of challenges. And I think...
Were you operating during the COVID pandemic?
Yes. Yeah. Yes. So yes, that was probably one of the biggest challenges. We were in an odd way. So I had a business coach before and during that period, and actually we pivoted very, very hard in terms of offering free Zoom sessions to everyone immediately to show and demonstrate that we would still be there to support them, because we have a patient database and we're only as good as helping our clients out. So we wanted to try and maintain revenue coming in. Now, it wasn't known how long this was going to, but it was fairly obvious that it was probably going to be months. And I sort of set that out to my team very, very early on to go, guys, this is going to probably last 2, 3, 4 months. We don't know. Everyone needs to get comfortable with this, but we're going to deliver all our sessions remotely. And so we pivoted hard from that. I only had a smaller team at that point in time, but we were able to maintain about 50 to 60% of our revenue during that sort of 3-month period. And fortunately, we had some good landlords and licensors who we were able to mitigate some rent during that period. So that sort of helped. So we were able to maintain some cash flow. And then at the end of sort of COVID, I saw it actually, after sort of 3-4 months, saw it as an opportunity to grow. So we brought on, over that next sort of 6 months, we brought on several people to sort of grow and develop, because I knew people would need more support. And if we had that ready to go, we should be in a good opportunity, in a good position to deliver that.
And has the remote treatment or the online part of your practice, has any of that sort of survived the return from lockdown? Do you still offer that, or is that not really a thing in your world?
I mean, we were possibly doing, I can't remember the exact figures, but maybe 150 virtual sessions a week almost across the team. We might do 7 or 8 now a week. So I think it's become a lot more accepted. It's become more normal because people have experienced it. But we're not doing anywhere near the levels because people want to have someone get their hands on them. People want a more specific assessment. But actually, it's incredibly useful. I've been in this game for 25 plus years. I think I can actually assess someone remotely and have a pretty good understanding what's going on with them, and then guide them on their journey. Okay, I can't get my hands on, but actually that's a really useful tool if they can't get into the clinic. So it definitely has a role. We're doing more than we used to do pre-pandemic, but not anywhere near the sort of level that we were during that acute period.
And what is, just moving on to the risk management side of things, what are some of the key risk management issues you face from running the service? I mean, particularly that it's across a number of sites. And what steps do your team take to ensure that you have consistency and that you deliver a quality of care across the sites that is consistent and of a high standard?
I think from a risk management point of view, I think as we have grown, we have more sessions occurring per week. So I've probably come to accept that we're more likely to have little issues that crop up. Just the nature of having 400 to 500, 600 people through the clinic on having appointments per week, that you're going to either get the one person who's not a particularly nice character, who might threaten us because they haven't liked our cancellation fees and kick up a big fuss about that. So I think I've grown an understanding that, excuse my French, but shit can happen because of the volume that we're now doing. Now, that has meant that I want to cover my backside a little bit more in terms of ensuring that I have appropriate, professional indemnity insurance, appropriate public liability insurance, that from a logistics point of view, that all the sites are running smoothly, that all the equipment is checked adequately. If there's a safety issue that's flagged up with one of our gym equipment or Pilates equipment, that we deal with that. We have a management structure in place whereby there's a clinical team, there's a practice manager, and there's communications across those areas to understand if there are any issues that are flagged up. In terms of quality controlling what we do, we have a tiered system of treatment so that we have some slightly younger physios, I don't call them junior physios, and then sort of lead specialists and consultant level physios. And we've built a very, very structured mentoring and education program so that the younger ones are incredibly well supported and have one-to-ones every week. And they go through specific training across certain areas so that we know that they are comfortable and confident with different pathologies and managing different sort of clinical situations that might crop up. We like to sort of have a very open door policy, and I think we put education at the forefront of what we do, and that helps us in a lot of areas. And I think it also helps us to quality control because we know where everyone's at. We do peer reviews, but they feel comfortable enough that they can come to us if there's a little issue. If they don't feel like they've managed someone well or something has cropped up, and then we can jump on it quite quickly.
Yeah, thank you. And patient safety and quality of care are obviously paramount in any healthcare setting. You've talked a little bit about some of the protocols that you've implemented across your clinic to minimize those risks and to ensure consistent standards of care. Can I ask you a question about how you deal with patient feedback? Because presumably you get a lot of feedback in online reviews and so on, and how your business tries to get maximum benefit from that and to use that to drive learning and improve standards in the business.
Yep, sure. So we were very poor with collating patient reviews, and our marketing team were like, Simon, you have 0 Google reviews. What the hell are you doing? You've got a couple of big clinics. You need to get on it. And we were very fortunate that we had built a reputation whereby we had a lot of referrals from the medical network into us, and they recognized our level of professionalism and what we did, and we delivered high quality care. But we didn't have a lot of the public. So last year, we pushed that fairly hard in terms of getting a lot more Google reviews. Now, we got a lot of feedback directly from clients, but actually the Google reviews have helped drive the business. We have seen an upturn in people just Googling us and choosing us because of the number of reviews or the quality of the reviews that we've had on Google. And that's something I didn't quite expect. So that's been a useful source. We get lots of direct and indirect client feedback. So I still probably see the lion's share of new clients and feed them into the team, depending on whose appropriate skill set is for that particular client. And then I'm catching up with that client in 4 weeks, 6 weeks after they've had a series of treatments. And that's one way that we quality control, because I've set the parameters, the diagnosis and the treatment pathway. But then we're also getting direct feedback on, okay, well, how are you getting on with so-and-so? How is that treatment progressing? Are they progressing you? Where are you at? Okay, you're doing really well, actually. So great. But actually, hang on, You're not progressing as well as what's going on. And so we get that very direct feedback from clients, and we get a lot of indirect feedback on our front of house team and our admin team from clients. They're generally pretty open. We have also recently partnered with a data tracking company called Simplicity, because we need to continue to show evidence and objective data that we are helping patients, we're optimizing these patients, and that we can do this at a level and provide that evidence that actually the profession is holding itself in high regard, or perhaps that's a shitty way of saying it or looking at it, but it's, getting appropriate data to suggest that we're making objective change to these individuals and these patients. And we're using an external data company to track measures like their pain scales, their net promoter score, their global rating of change, which are some other markers. And these are simple measures where you can demonstrate objective change on these particular patients and also demonstrate how quickly that is happening, so that we can validate how effective we are versus other clinics and across other professions. So there are a couple of ways that we're trying to quality control and also ensure appropriately high levels of care across the team.
Yeah, thank you. And presumably that's very interesting, the data exercise that you're undertaking, because presumably that can also help you to identify the most effective treatments, but also those that can be improved, where you can enhance the service.
And I think you have to have a fairly open view of this and look at it that, okay, this is all a learning tool, and patients can put down specific objective and subjective feedback with this process. And so that we want to continue to evolve and better our service. And what we were doing 5 years ago is constantly evolving in terms of the current evidence base for how we use shockwave therapy versus needling versus sending someone off for a PRP injection, or the current evidence base for specific exercise-based modalities is always evolving. So our treatment progresses. And likewise, in terms of collecting data, I think we need to take that feedback on board, because we might think things are happening one way, but the client perception is a little different.
Sure. In an ideal world, what would be the most important things that you would look for from your indemnity insurance providers to best support you as an individual physiotherapist, but also to support your business as a service provider?
Good question. And I'm part of a group called the MSKPN, and these are a group of private network practices around the country. And this area crops up occasionally. I think cost is one area in terms of, having it paying at an appropriate level for that particular service. I think clarity of what is covered. I think that is often tricky in these discussions with individuals, and often there's not a one-stop shop for, we have a provider for public liability insurance and your employer's liability insurance, but then you have another professional indemnity insurance. Now, could they not be sort of wrapped up in the whole one service? Could they not be linked in with your HR issues? Because, a contractual issue soon becomes a bit of an issue that's not quite the professional indemnity insurance issue, but it is all sort of often weaved around sort of how you run your business effectively. I think also in terms of healthcare is in an inexact science. And, recently the CSP has pulled insurance cover for people using acupuncture on the thoracic spine because there had been an uptick in pneumothoraxes created through this. Now, there was not clear and careful information about that, and the Acupuncture Association of Chartered Physios has stepped in to provide extra cover, but it's also meant that some of my team who've done other courses are perhaps not indemnified at the appropriate levels. And there seems to be in our profession a little mismatch between the individual physios cover and what the company cover that the company sort of takes out, because you're sort of obligated to have CSP insurance, but actually does that really cover that individual? Because I think that they then go after the company. But this is probably where your expertise will come in. But I think what else would I want? I would want more information. I'd want someone on a hotline to be able to call up and go, you know what, we're just having this at the moment. Where do we stand? What's the situation? And having a discussion whereby it wasn't interpreted as, oh, you're doing something outside of that ring that we cover you for, you're in trouble, we're suddenly going to drop your cover. That you can have these conversations, because the way we treat and manage clients is ever evolving. How we use Shockwave now is a bit different to how we used it 5-8 years ago. And just making sure that we tick all those boxes and know that if we have these processes in place, we should pretty much be covered.
Yeah, thank you. That's really very interesting answer. I've asked that question to a number of different sectors, people from different sectors, and so on, and it does seem to be a very recurrent issue that what people don't want is they don't want to have siloed care insurance cover. They don't want to have their employer's liability in one pot, their public liability in another, and their medical malpractice or professional indemnity in another. And I think this is hopefully a growing trend. Certainly at Altea, we offer a combined cover, so we cover all of the liabilities. And I think the other point that I would take as someone working on the insurance side from what you've said is the importance to have a continuing dialogue between the insurer and the client and the practitioner, and really to, as you say, the health sector is a moving target. Yeah. It's an evolving beast, and it changes and changes. And we're seeing that across the various sectors that we work with. So I think it is very important to reflect that, and for us as insurers to have a really good grasp on your world so that we have a better understanding of that, and that there is then a communication between us. So that's very interesting to hear your answer on that. Thank you for speaking so eloquently about that. Moving away from insurance, and just as we start to wrap up, can I ask you to get your crystal ball out and to let us know what future trends you think are going to shape your profession in the next few years?
Future trends is an interesting area, because I love tech, I love toys, I love, testing out new things. I think, like any sector, AI will revolutionize healthcare to a degree. There's a new piece of software that we have been using in here that is such an efficient use of our time. It's a game changer, and it makes our clinical notes significantly more expansive. We capture far more detail. We can turn our attention to the client. We can then push out letters very, very quickly. I think that area will continue to evolve and grow. I think it will get to a stage where, okay, we're really not typing much. And already over the past couple of months, that is me. I'm not typing nearly as much because I'm using this piece of software with everyone's permission to capture significantly more detail. So I think that will be a big growth area. I think looking at combining some health tech with our treatments, I think will continue to evolve. We use blood flow restriction devices for some of our training. I think incorporating that into clothing is being done by a couple of companies, and I think that area may continue to grow. I think we'll probably see more specific massage devices, your AI robot that might sit alongside a physio, so that a physio can go, okay, right, this is what's going on. Can you do this as part of the treatment? And that robot may be able to come along and assist with that. And I think these are sort of growth areas. I think wearables are massive. We have a team of people that we track on Whoop. I think they will continue to evolve. I think being able to pull APIs together and track everyone's data, I think will continue to evolve. I know a lot of people are skeptical about all the data out there, but for me, it's just, there's no patient demographics with it. It's just, heart rate data and heart rate variability and all of these things. And these are helping to optimize people and individuals and what they're doing.
And sorry to interrupt, but that goes to the preventative approach as well, doesn't it? It's helping people to help themselves to stay healthy.
Exactly. And, that looks at recovery, which is such an important, your sleep, how you're managing your stress, and our wellness side of our company dives into that in far greater detail and gets a snapshot of people over a 5-day period of what their sleep stress cycle is and what they can do about all of that. Now, I think all of these systems will grow out and develop, and I think AI will be at the heart of a lot of that. But I still think, I don't see in healthcare that you could take away that human touch. If we don't embrace AI, I think we'll be left behind, but I think we'll still be involved as the key decision makers a lot of the time.
Yeah, it's partnership, isn't it?
Yeah.
Yeah, that's fascinating. And certainly from the sort of research I've done and people I've spoken to, AI in the health sector, AI certainly does seem to be the way forward, given the challenges, some of the challenges we've spoken about.
Even from a simple data collection point of view and a
administrative
point of view and clinical notes point of view. I can focus my attention now on the patient and have this running in the background. I press a button and I've got these pretty amazing detailed notes that have just been put into SOAP format that are fantastic. And I would not have the time to detail everything like it has done and then continue that sort of high level of treatment.
So all you need to do then is check the notes for their accuracy. Check the notes,
exactly.
Yeah.
So I check the notes through, I tweak it a little bit, add a little bit more of the specific treatment that it may not have captured, and then I upload them to our clinical software.
Fantastic. It's been really good talking to you today. Thank you so much again for your time, Simon. Just to wrap it up, my final question, what single piece of advice would you give to someone embarking on a career in physio in the UK today?
Single piece of advice. Okay, so if they've already embarked in physio, I want people who come in, and there's 3 simple things that I look for to come into the company. They need to tell me that they want to help people. So you need to have a passion for helping people. If you're going into physio and thinking that you're going to end up at the pointy end of high-level elite sport, there's about 2% that might do that. So you need to want to be able to help people. You need to be passionate about learning and developing and growing. And you need to work your socks off. You need to go, and if you're going through your training at the moment, go and work in a sports club. Be a sports therapist, be a massage therapist. Go and put yourself out there. Do multiple jobs and just expose yourself. And that is the best thing you can do, because some of the training courses in the UK are perhaps not at a level that they are around the rest of the world. So you almost need to work harder to progress yourself. But if you go into this career, you've got to be able to help people and want to have a passion for learning and growing.
Thank you. And I think we'll draw it to a close there. I'm sure there's a lot more that we could talk about, but thank you so much for talking to us about your world and for appearing on Altair Talks. It's been an absolute pleasure to have you on the podcast. Thank you very much, Simon.
Thank you, Will. That was excellent and a bit of fun.
Thank you for tuning in. I hope you enjoyed today's episode of Altair Talks. If you did, please don't forget to subscribe or leave a like or a review on whatever platform you're listening on, as this helps spread the word. If you have any questions or comments or topics you'd like us to explore in future episodes, please do contact us, as we'd love to hear from you. You can find us on LinkedIn or visit our website at www.altairinsurance.com. Stay tuned for more episodes, and until next time, take care of yourselves.